So now what are the foods that make it better? Because this is the interesting part. This is where you can have more control, right? So remember, when we're treating inflammation or arthritis or joint pain, we're not just looking for one thing that makes it better. We want to eliminate what makes it worse and add what makes it better. So here's the adding of what makes it better. Anti-inflammatory foods in general. Now, a lot of times people are told this is an anti-inflammatory diet, and it's very confusing out there. What is an anti-inflammatory diet? Is it a Mediterranean diet? Is it this diet? Is it a low-carb diet? Is it the other diet? Well, an anti-inflammatory diet is a diet that when you consume it, it doesn't promote inflammation. And the most effective and the most anti-inflammatory diet that we've seen, whether in studies and clinical practice, in my practice, is a plant-based diet. And it's a whole food plant-based diet, meaning whole, meaning it's not over-processed. Maybe it's processed into a pasta or a rice, and you have to cook it a little bit like a whole grain or bean, but it's not overly processed like in packages and all that. So a whole food plant-based diet, and we'll talk a little bit more about that. Turmeric in food. Turmeric is a spice. We'll show you pictures of that. Ginger, garlic, and spice and herbs definitely make a big difference. We'll have talk a little bit about that later. And plants that are rich in vitamins and antioxidants and phytonutrients and minerals. And by the way, phyto means plant, so phytonutrients are only in plants. So when you eat fruits and vegetables and herbs and spices, you're adding a lot of those elements in your diet, and you're going to be healthier because you're helping your body heal better and your cells get healthier. So to help nourish your cartilage and your joint, these foods can help decrease the inflammation, plus they nourish and they provide the nutrition your body needs. So anti-inflammatory plus nutrition supplies the nutrition. So the foods that are beneficial for arthritis, I just give you a few examples. There's plenty, but let me just go through a few of them. So in general, most plant food, if they're whole, they're not fried or made in a syrup, are actually healthy and beneficial for the joints in general and for health in general. If you're healthy, then your joints are healthier, right? So it's not just the joints that we want to focus on. So spices and herbs, it's amazing. Always amazes me with spices and herbs. So a little bit goes a long way. They're so potent, so powerful. And it ranges anywhere from like your turmeric, your ginger, black pepper. Usually black pepper does very well with turmeric. You want to make sure you have black pepper with your turmeric so it's better bioavailable and has more potent benefit, better anti-inflammatory benefit. Cinnamon, cayenne, which is what capsaicin is made of, cloves, rosemary, sage, green tea, etc. The list is huge. Fruits, berries, cherries, pineapple, citrus, and yes, cherries can help. One of the myths is it a myth that cherries help with gout? Cherries do help with gout. Cherries also help with inflammation in general. But that alone is not going to take care of the problem. Pineapple, we'll talk about bromelain in a minute, but pineapple contains bromelain, and bromelain has anti-inflammatory benefits. Vegetables, especially green leafy vegetables. The more you can increase your diet with green leafies, whether you're putting in a smoothie or you're putting it in your plate or you're steaming them or you're adding them to your soup and stews, anywhere you could add greens, you're doing yourself a favor. So every day, ask yourself this question: did I have something green leafy today? If not, go and eat some. Now, when people have kidney stones, oxalate kidney stones, like calcium oxalate, you just don't want to be eating of one kind of green so much of. You want to have a variety of greens. So for example, if you eat too much spinach and only spinach, and you have kidney stones, oxalate kidney stones, you're raising your risk for that. If you eat too much Swiss chard and only that could raise it, or the leaves of the beets, that can increase it, or rhubarb, etc. So make sure that you're hydrating well and you're eating a mixed variety of greens, not just one thing only, especially if you have tendency for kidney stones. Fiber in plants actually has benefits to arthritis. So what is rich in fiber? Every vegetable and fruit, and the richest are the whole grains and the legumes and the beans and the soy. If you're not soy allergic, so you can do soy. Nuts and seeds are also very powerful, especially ground flaxseed, chia seeds, walnuts, hemp seeds. These actually are packed in omega-3, and omega-3 is anti-inflammatory. So you consume those, you get more anti-inflammatory benefit.